have theoretical and practical courses with us, and until the graduation we will be together with you all. And now I would like to share my slides and begin the course. Please feel free to ask questions when you need, or anything you didn't understand, I can explain. I'm trying to give the lecture in English, but sometimes I can speak in Turkish if I need to, if I need to explain things a little bit more. And if you need anything, you can tell me during the course. Can you see the slide now?
Görüyoruz hocam.
Now, today's course is entitled Introduction to Preventive Dentistry in Children. But while we are talking about children, we mention small children, school children, adolescents, and young adults. So not only school children should come into your minds. And I would like to give some brief information about preventive dentistry as a whole, but it's of course a big subject. You can have further readings for that. You can find further readings in textbooks, in chapters related to pediatric dentistry, or only books related to preventive dentistry are published. So this course will be only a brief introduction. So what is prevention? Prevention is defined as the action of stopping something from happening or arising. Prevention can be related to other subjects in the world, not only in dentistry. But in dentistry, we use prevention for dental caries and periodontal diseases mainly, because these two main diseases are the most prevalent diseases that cause destruction of health, oral health. That's why we are trying to prevent these two main diseases to happen in individuals. So when we look at the history of preventive dental care, we see Alfred C. Fones, he is the founder of dental hygiene and preventive dentistry around 1900s, and he mentioned that hundreds of millions of dollars in public and private funds are expended to restore the sick to health, but only a relatively small portion of this amount is spent to maintain the wealth of well people. Even though it is definitely known that the most common physical defects and illnesses are preventable. So this sentence was an introduction to preventive aspects, preventive point of view, and then of course many researchers, many doctors, and many health caregivers were interested in this subject. And in the year 2000, in the United States of America, the Surgeon General's Oral Health Report was published. Of course, it's a very compulsory and big report, but in that report, they explained why oral health health is essential to general health and well-being. So when we talk about oral health, we talk about the overall well-being of individuals and the wealth in their quality of life. So when we try to prevent dental or oral diseases, then we are trying to make people in a better way of life, in a better general health and well-being. So in this report, there were major themes and major findings, and these major themes included: oral health means much more than healthy teeth. Oral health is essential to general health. Safe and effective disease prevention measures exist. So this is the situation around 2000. Now we know that we have to prevent oral diseases for these reasons. And let's have a look at the important concept of caries prevention. Why do we need to prevent dental caries to happen? First of all, we know that erupting teeth are healthy because dental caries is an acquired disease, which means it's not congenital. We don't come to life with dental caries. It's impossible because we know the etiological factors that cause dental caries. These are the host, so we need the teeth to be present, and they are the other factor is microorganisms, so they have to be together with the teeth, and we need a substrate, which is the carbohydrates. So we need the teeth, the carbohydrates, and the microorganisms to be together to cause a dental caries. So in this course, which is named as Cariology and Preventive Dentistry, you will understand and you will see the etiology of dental caries, and then you will relate the prevention of dental caries together. So we know that erupting teeth are healthy, and a dental caries is an acquired disease. So we need to keep these, maintain the health of the teeth throughout life. Why? Because the first caries lesion and its restoration marks the initiation of a serious treatment, which usually are more complicated restorations. So a first small filling is changed during the years, and when we change and we replace a filling, we usually lose more tissue from the teeth, and then we make larger cavities and larger restorations, and sometimes these restorations fail, and then we need to do root canal treatments, and then we need to make a crown, full crown restoration. Then these are the more complicated restorations, and sometimes the individuals lose their teeth due to these restorations or the failing restorations. Then we need to extract the teeth, and then we need to place implants. So first caries lesion is the beginning of the whole story. So we need to do, what we need to do is to help people to maintain healthy teeth without dental caries. And today there is sufficient scientific knowledge about the etiology of caries and about factors that interfere in this process in order for us, I mean the researchers and the health caregivers, to develop effective preventive strategies. And there is no excuse not to use this knowledge in attempts to control caries. And there are a number of factors that should be taken into account when preventive programs for young people are planned. What are these factors? We call these factors determining factors in caries prevention. So the first three were risk factors which have a important role in the etiology of dental caries. I counted them in the previous moment. The plaque and so-called dental biofilm, and is the cariogenic microorganisms in the plaque. Another risk factor is the substrate, the diet of the individual, and mainly the fermentable carbohydrates. And we will talk about these in the upcoming courses, especially the microorganisms and diet. And of course, the host. Host means the place where the disease happens, and the tooth morphology of the individual, the features of the saliva, the properties of the individual saliva, the immune system, and everything are related to host factors. And there are risk indicators. They are not directly related to the disease, but they are indirectly, but have an important role indicating that a person is prone to the disease or can be stronger in the prevention of the disease. So the knowledge of the person or the family, the awareness and attitudes of the individual to dental caries, practical applicability of the measures that we should plan, and compliance of the patient and compliance of the family, and the lifestyle is important risk indicators. Let's have a close look at them. A risk factor plays an essential role in the etiology and occurrence of the disease, while a risk indicator is a factor or circumstance that is indirectly associated with the disease. So the risk factors are to some extent easier to handle with existing preventive measures. So we can control the microorganisms, we can give something for diet, for example. We can cancel the diet and we can change the diet. And however, the risk indicators are also important determinants for a good preventive outcome, but also more difficult and complicated to influence. For example, the awareness, the attitude, or the lifestyle of the individual are not easy to change in a moment. Caries prevention should be given a high priority by the dental profession as well as by governmental authorities. The pediatric dentist has a very specific responsibility in meeting the challenge of keeping children and adolescents free from caries, because the pediatric dentist is at the beginning of everything. At the beginning of life, we see these people, and if we handle them good, if we give them the important knowledge that they need to keep their health, to keep and maintain their oral health, then we can be effective in the prevention of dental caries in the beginning of their life. Very young children, for example, with early signs of caries should be given special attention, as they tend to develop more caries compared to children without early signs of caries. And we do that. When we see small children around between 2 and 6 years old, we have a close relationship with them. We monitor them very often, and we see them more in 1 year, for example, three times, 4 times a year, and then we try to prevent these dental caries to proceed to get larger or to get severe. And then we try to educate the parents, we try to educate the environment, and then we try to educate, of course, our students and the other healthcare givers, for example, the medical doctors or the pharmacists. We try to give information to the public. So it's a very important issue that we try to work on. And when we talk about early signs of dental caries, you can see here and here and here. And we will talk about these early childhood caries when you are in the 4th grade, I think, in the clinical applications courses. You will be informed about that in detail. But when we here see these kinds of early signs of dental caries, we, as I mentioned, focus on the parents' diet and education of the individual. So even if the principles of caries prevention are simple, the implementation, management, evaluation of programs, and recommendations can be difficult. And there are different concepts which are used to describe preventive activities. And they should be personalized and tailored to the individual patient's needs and motivation level. So there is not only one program that we can use to the all people in the public, in the community. We should understand the patient's needs. We should understand the patient's motivation level. We should try to see the awareness level, attitude, and for example, we should ask questions about the lifestyle, the socio-economic and socio-cultural status of the family. Oral health promotion is an activity which takes place at the community level with the purpose of making it easier for people to live a healthy life. And oral health is not a minor health concern. When we talk about oral health, we don't talk about 32 teeth only. There are many things surrounding these teeth, many tissues. It's a live, living environment. It's a habitat for microorganisms. And so it's a big issue, and it affects overall health and well-being throughout life. And when we look at the relationship of dental diseases and systemic health, we see that the untreated dental disease results in children with constant pain, which is a very sad situation for a small child, difficulty in eating and speaking, chronic infections, increased use of pain medicine, and embarrassment over the appearance of their teeth. Sometimes small children lose their teeth very early in their life, and they have problems with speaking, smiling, and relationships with their peers, and they need to suffer from these situations. So we should understand it's a very big issue for their that period of life. And also research has linked periodontal diseases to systemic diseases, such as cardiovascular and respiratory diseases, diabetes, cancer, premature and low birth babies, and other systemic diseases. Can anyone tell me what a periodontal disease is? Do you know what a periodontal disease means from the class? Do you have any idea? I'm mentioning it, but I'm not sure you have any ideas about that. Evet, sınıfa soruyorum. Periodontal hastalık nedir? Ne demek istiyorum? Bir bilginiz var mı?
Diş eti hastalığı olabilir mi hocam?
Evet. diş eti diyebiliriz kısaca ya da genel Türkçe adıyla diyebiliriz. Başka bir fikri olan var mı?
Hocam
Do you have any? What is periodontal disease?
hocam periodontal ligamentlerle ilgili bir şey olabilir mi?
Periodontal ligamentlerle ilgili bir şey olabilir. Evet. Periodontium belki sizin için biraz erken olabilir. Bu bilgiler henüz daha yavaş yavaş veriliyor. Ama dişle ilgili yapıları incelerken duyduğunuzu, öğrendiğinizi tahmin ediyorum. Dişleri çevreleyen periodontium adını verdiğimiz dokuda ya da yapıda bulunan tüm dokuların ve dişi destekleyen dokuların ki alveol kemiği, periodontal ligament ve çevresindeki işte diş eti, mukoza, serbest diş eti bütün bu dokuları ilgilendiren enfeksiyonun ve buna bağlı hastalıkların genel adı olarak Türkçeleştirebiliriz. Ben 2 ana hastalık dedim ama bu dersin kapsamında daha çok diş çürükleri üzerinde konuşuluyor olacak. Periodontal hastalıklar da size zaman içerisinde tabii ki bütün bunlar özellikle 3. sınıftan sonra öğretilecek ama biz burada prevention derken her iki tarafı da yani diş çürüklerinde periodontal hastalığı da önlemeye çalışıyoruz. Onu anlatmak için de bu bilgileri veriyorum. Teşekkür ederim cevap veren arkadaşlara. So periodontal disease is the disease of periodontal structures, the tissue, which support the teeth in the mouth. So alveolar bone, periodontal ligaments, the gingiva, the oral mucosa are affected in this periodontal disease, and it's an infectious disease from some special type of microorganisms in the mouth. And this periodontal disease usually causes these types of systemic diseases. And research has linked these diseases with periodontal disease. So when we talk about oral health, we talk about healthy teeth and healthy periodontium. That's why I try to relate these to prevention. So the World Health Organization, you know, it is the biggest organization in the globally for the health of human beings. And they define health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What do we mean by that? If health is not described as merely the absence of disease, prevention then becomes an essential component of health and the definition of health. For instance, some individuals may actually be in excellent health, but they believe for some reason logical to them that they have oral cancer. These individuals do not have optimum mental well-being and will continue to worry until they are somehow convinced otherwise that they are indeed healthy. Another person may be functionally healthy, but physically disfigured and consequently shunned socially throughout life. And this is an example. This girl with Down syndrome is an example, and she may be functionally healthy, systemically healthy, but when we look at her, we think that something is going wrong with her, and we can think she's suffering from something. So health is relatively changing from person to person and from some concepts. Thus, health can at times be what the patient thinks and not the actual condition of the body. Primary preventive care focuses on the preventive aspects of the dental hygiene sciences and emphasizes the use of diagnostic and therapeutic modalities prevent disease. What are they? A therapeutic modality is a method of applying or using any therapeutic agent. A diagnostic modality is a method used to diagnose a condition. For example, we can use fluoride. We can apply fluoride to our patients in order to prevent dental caries, and or they can have some sensitivity in their teeth, and then we can again use fluoride to decrease the sensitivity. Then we use a therapeutic agent for that. And diagnostic modality, for example, we can use X-rays for understanding the patient's severity of the disease or the depth of the dental caries, for example. So we need to diagnose the disease, and then we use a diagnostic modality in order to manage the disease in a very best way. So when we look at prevention, it is small but more important, and takes more place, should take more place in the people's life. And the mission of dental care, which are given by the dentists, is the ability to help individuals achieve and maintain maximum oral health throughout their lives. From birth to death, we try to give the maximum oral health that they can have. Let's have a look at the levels of preventive dental care. There is the primary prevention, which is the beginning of everything, which uses strategies and agents to prevent the onset of disease, the beginning of disease, reverse the progress of disease, or arrest the disease process before secondary preventive treatment becomes necessary. This level is sometimes thought of as dental hygiene. So when we first see the patient, they don't have the disease, we try to give information for the nice and correct dental hygiene, and we try to give some prophylaxis, cleaning of the teeth, and there are many examples for primary prevention. And for secondary prevention, we can say that it uses routine treatment methods to terminate the disease process and or restore tissues to as near normal as possible. And this level can be termed as restorative care. And there is the tertiary prevention, which uses measures necessary to replace lost tissues and rehabilitate patients to as near normal as possible. And this level can be termed as reconstructive care. So let's have a look at the kinds of therapies and services related to these levels of prevention. We see oral evaluation, dental prophylaxis, fluoride application, dental sealants, health education, and health promotion in primary prevention. And in secondary prevention, we see the dental restorations, but of course, they should be minimally invasive, and they should not cause the loss of dental structures. So we should be preventive again while doing the restoration. The periodontal debridement, the cleaning of the teeth, fluoride use on incipient caries, dental sealants, and some types of restorative treatments are the therapies and services given by secondary prevention. And finally, the prosthetic appliances, the implants, and oromaxillofacial surgery applications are in the tertiary prevention of the individuals. And let's have a look at the primary caries prevention. At the time of the clinical and radiographic examination, the first step should be to look for incipient caries lesions, and which is the initial stage of tooth decay, and gingivitis, which is the beginning of the periodontal disease, and it means the inflammation of the gingiva. Then preventive strategies could be applied that would result in a reversal or control of either or both diseases caused by plaque. The main etiological factor in these both diseases is the dental biofilm or microbial dental plaque, but sometimes the types of the microorganisms determine the type of disease which will happen in the mouth. Some microorganisms are cariogenic, and if they are more in the plaque, then we see dental caries. And some of them may causes periodontal diseases, and you will see these types of microorganisms in the upcoming courses, of course. Even if these primary preventive dental modalities fail, tooth loss can still be avoided. In practice, the early identification and expeditious treatment of caries and periodontal diseases greatly minimizes the loss of teeth. When such routine diagnostic and treatment services are linked with an effective dental hygiene program that includes a periodical dental examination and appropriate recall appointments based on risk assessment, tooth loss can realistically be expected to be reduced to zero or near zero. And in the second midterm, in the spring midterm, you will be preparing some educational programs to people, of course not real people, but you will think that you have young people or adults across you, and you will be preparing some health education programs which will be related to dental caries or periodontal diseases. And while you are preparing and listening to those programs, you will be understanding more. And the principles of caries prevention are simple, and let's have a look at them. There is strong scientific evidence that in order to prevent, reverse, or slow down caries lesions, one or several of the following factors have to be altered or utilized: the diet of the individual, the oral hygiene, the exposure to fluoride, and fissure sealant are the main topics related to prevention of dental caries. However, it should be emphasized that the factors should not be looked on as separate entities, but as highly interactive. They interact with each other. For example, good oral hygiene enhances the effect of topical fluoride application. The most important key to prevent tooth decay and periodontal disease is patient motivation and oral hygiene education. If we don't motivate the patient and we don't give any education, we shouldn't expect the patient to apply these methods or apply these measures at home. So we have an important role in the motivation and education of the patient. And the patient needs to be motivated enough to learn and actively perform the measures to protect his or her oral and dental health. So this is important. However, giving education to a patient may not always be sufficient. Just because the individual has some knowledge does not mean that he will use it in daily life. Socioeconomic conditions and cultural habits affect the perspective of patients. So I have a good example for that. How many of you are there in this class? Let me see. You are around 100. I cannot see that right now. Do you know smoking is bad for general health? Do you have any idea, or this is the first time you're hearing it? Can you please tell me?
Yes.
Do you have any idea smoking is bad for general health?
Yes, it's bad for general health.
Yes. And how many of you are smoking? Oh, you can only think of in yourselves. I don't want any raising hands, but I'm sure, I hope not less, not more than half of the classroom, but I'm sure plenty of you are smokers. And another one, maybe the information that driving fast is not a good idea. So it can be detrimental to general health. And your young people are usually fast drivers. So I don't blame you or judge you or anything like that. But when you have the information, you don't always use it for your daily life. Just because the individual has some knowledge does not mean that he will use it in daily life. So we need to give the information and also the motivation to use this information. So there are many methods of oral hygiene education. However, the effectiveness of each of these methods may not be continuous for every individual. For providing effectiveness in oral hygiene education and motivation, we should understand that training of the patient may contribute to oral hygiene development very briefly after the learning process. So when we see the patient for the first time, we tell them that they should brush their teeth every day, twice a day, and then they see that, they understand that, and maybe 2 or 3 days they use the information. As the duration increases after the training is completed, the individual tends to return to the starting position, and the small children and the adolescents do that. They go back to their daily habits. One-time training is not enough to learn and change habits, but showing useful materials such as toothbrush, floss, toothpaste can only be effective for a few weeks. And the upcoming courses, we will we will give you some lectures on oral health education and these materials and showing the plug to the first people or the then patients. We will try to give examples for them. And repeating the education periodically and close supervision over several visits is the correct and effective approach. So these are the basic principles for giving education, oral hygiene or dental health education to patients. But as I told you before, in the spring semester, you will, in groups, you will be giving virtual people, not real people, information and education using some, for example, brochures and PowerPoint and maybe videos you will take, and then we will try to get into detail in these educational methods. And you should keep in mind that timing is very important for oral hygiene education. When you have a patient with a toothache, didn't sleep well during the night, has a toothache, has a dental fear and crying, or they came with a dental trauma, a broken tooth or a fallen out tooth, something like that, you will not be successful in the dental hygiene education. But a dentist who gains confidence from the family and the child after achieving successful dental treatments can provide effective training. Additionally, the results of oral hygiene education should be supervised and controlled periodically. So when you give an information, you should check for it in this in the further sessions, then you will be more effective. So for the last words, I can say that the duty of dental professionals on enhancing the quality of life in a community begins with their attitude towards their pediatric patients. So I can have some moments for questions. If you have any questions. And I'm trying to unshare. Okay, do you have any questions from the class? I'm waiting for questions.